It's my great pleasure to be your MC today. 외신 기자 여러분 안녕하십니까? 보건복지부 외신 대변.
Ladies and gentlemen, we will now start the FPCKorea Policy Forum on COVID-19, co-hosted by the Ministry of Health and Welfare, Korea Disease Control and Prevention Agency, and the Ministry of Korea Culture and Information Service. I'm Monica Kim, and I'm a global media spokesperson.
Please wear a mask during the entire program. 감염병 예방 수칙에 따라 행사 중에는 마스크를 착용해 주시기 바랍니다. Simultaneous interpretation is provided for today's event through the receiver found on your table. Select Channel 1 for Korean and Channel 2 for English. If you don't have a receiver or need assistance, please let our staff know. To be strategic with time, I will proceed in Korean for the remainder of today's forum. 오늘 행사는 동시 통역이
Simultaneous interpretation is provided for today's event through the receiver found on your table. Select Channel 1 for Korean and Channel 2 for English. In today's briefing, we have the Second Vice Minister Lee Gun-hyuk from the Ministry of Health and Welfare for opening remarks, and Mr. Kwon Jun-uk, Director of Korea National Institute of Health, and Mr. Lee Gang-ho, Deputy Minister from Office of Global Vaccine Hub, and Ms. Park Hyang, Director General of Disease Control Coordination Task Force. In addition, we have Mr. Son Young-lee, spokesperson from the Ministry of Health and Welfare. And we also have Mr. Choi Myung-soo, Director General for Foreign Media from Korea Culture and Information Service, the Ministry of Sports, Culture, and Tourism. So before going into the presentation, we will have the opening remarks by Vice Minister Liu. Nice to meet you, everyone. I am Lee Gun-hyuk, Second Vice Minister of Health and Welfare. I'm very delighted to have an opportunity to talk about Korea's COVID-19 response to foreign correspondents. Ever since Korea had the first COVID case in January last year, for the past 1 year and 10 months, we have gone through a number of difficulties and challenges. However, thanks to active support from the public, great contribution from medical professionals, and hard endeavors by the government, we could control those challenges. In handling and controlling the pandemic, Korea has always responded with 4 main principles: openness, creativity, transparency, and democracy. First, without severe containment measures such as border closure and lockdown, we have managed the COVID-19 by keeping our society open. In this process, with 3 T strategies, test, trace, and treat, we could minimize the scale of pandemic. Instead of full-scale containment or lockdown, Korea's social distancing measures have been precisely designed in a way to limit the number of people gathering and operating hours of high-risk facilities. Second, we have steadily come up with creative and effective ways to control pandemic. Drive-through screening center is the best example. By taking full advantage of our advanced IT, we have reinforced and further improved the number of disease control, such as EISS, QR code system, and self-quarantine app, and leftover vaccine booking system. Last February, we had a capacity to test 20,000 PCR tests a day. However, our capacity has expanded to cover 680,000. At this moment, the daily average for testing is more than 300,000. Third, integration and communication are critical in deciding preventive policies. By setting up Central Disaster and Safety Countermeasure Headquarters, both central and local governments are having daily meetings, while related expert committees are also working on the same matter. Through more than 5 times of national briefings in a week, precise and accurate information can be delivered to our public. Fourth, based on clear sense of ownership, our citizens have thoroughly kept personal hygiene principles, including face mask wearing, and voluntarily taken the screening test. Such public buy-in has led to active participation in social distancing measures as well. Vaccine rollout, started from this February, has expanded across the entire population much faster than any other countries, thanks to active public support and cooperation. Current vaccination rates surpassed 78%, and the rate for the population over 18 surged to 91%. All these hard efforts have greatly helped the stable management of COVID-19. Up until now, the aggregate number of confirmed cases is about 380,000, while that per 100,000 is 741. Total number of deaths is 3,000, and the aggregate fatality rate is 0.78%. Death toll per 100,000 is 5.8, which is one of the lowest on Earth. For the past 1 year, the overall death rate has not been further increased, even considering the death from COVID-19. On top of that, 2020 and 21 average economic growth rate in Korea is estimated to be 1.6%, which is the highest among G20. Without any complete lockdown, we could work to control social and economic damage from the virus. All these results are entirely attributed to our people's mature citizenship and active support. Such stable control of pandemic and high vaccination rate have helped us execute the recovery plan to a new normal from this November. Even though we may, of course, encounter some challenges ahead, Korea will overcome this pandemic crisis. With self-discipline and responsibility, we will continue to seek a balance between the disease control measures and a new normal, thereby moving toward a better Korea. In our battle against COVID-19, Korea will continue to work with other countries to overcome this global challenge and further reinforce international cooperation. Korea has so far provided disease control and preventive materials such as test kit and vaccine support to other countries. Moving forward as a global vaccine manufacturing hub, Korea will lead the supply of vaccines to the world. These efforts are expected to increase the global vaccination rate and ultimately contribute to overcome this crisis. I would like to give my deep thanks to all the foreign correspondents for attending today's event and hope to have diverse comments on Korea's public health measures. Thank you.
이어서 권준욱
And now we are going to have Mr. Kwon Junuk, Director of the National Institute of Health. He's going to talk about our responsive measures to COVID-19 and the vaccination progress. And Ms. Park Hyung is going to talk about the execution plan of a recovery to a new normal. And Mr. Lee Gang-oh is going to talk about K Global Vaccine Hub strategies and expected outcomes. After that, we are going to have a Q&A session. And now we are going to have Director Kwon from the National Institute of Health. He is going to talk about COVID-19 response and vaccination progress.
예, 비록 영어가 모국어가 아니지만 준비된 대로 영어로
Yes, my mother tongue is not English, but I will speak in English.
The current status of the COVID-19 responses and vaccination in Korea. 슬라이드가 Yes. In Korea, we are in the fourth wave of COVID-19 epidemic and also in the early course of phased return to normal. As of 17th November, around 403,000 cases are reported with a fatality rate of 0.78%. Currently, most high coverage vaccination countries are in the tough time for returning to normal. Global fourth wave just starts, mainly led by European countries. To minimize the public's health damage from COVID-19, we took advantage of 3 key strategies. This made it possible to immediately establish a COVID-19 response-related infrastructure. We adopted a pooled testing strategy and strengthened the testing system infrastructure to establish screening stations in community health centers and medical institutions, as well as temporary testing clinics nationwide. This way, we have significantly increased the public's accessibility to diagnostic testing. Also, we developed our epidemiological investigation system. First, we developed a contact tracing system known as the EISS. With the system in place, we are able to see the results through information analysis within just 1 hour. Second, strengthened human resources. For example, by newly revised act, local governments have to hire at least 1 epidemiological investigator per 100,000 population. This has led to a sevenfold increase in the number of epidemiological investigators. As a result of 3T strategies and risk communication, the public actively complied with the social distancing rules and participated in the government's efforts to control COVID-19 spread. This greatly helped us control a surge in confirmed cases and curb viral transmission. Korea places the highest priority to protecting the people's lives and health with a safe and timely accessible vaccination program based on scientific evidence. January 2021, the Korean government established the Interministerial Vaccination Control Tower leading by KDCA. The national program started on 26 February this year after being reviewed and guided by various expert committees. Korea was able to reach a high vaccination rate in a relatively short period of time. All of this was made possible thanks to the citizens who voluntarily and actively received vaccines, and health professionals and many others who devoted themselves to protecting the people's lives. As of September 2021, 30.7% of the entire population have been fully vaccinated. And then in less than 2 months, as of 23rd October this year, 70% of the entire population fully vaccinated. We develop all the vaccination plans under the scientific evidence with the highest priority on people's safety. Now, considering the highly contagious Delta variant, a gradual decline in vaccine efficacy, rising cluster infections, we are giving booster shots to high-risk groups. The COVID-19 vaccination system is basically based on the infrastructure of the National Immunization Program. All elements laid the foundation for implementing the COVID-19 vaccination program in a safe and fast manner. The Korean government signed an agreement to purchase 190 million vaccine doses in total. As part of the efforts to enhance the public's convenience and accessibility to receiving vaccines, the Korean government is running 282 vaccination centers and around 14,000 designated health facilities for vaccination. Although there were negative factors for vaccination, such as uncertainty of vaccine supply, concern over adverse events, 78.4% of the entire population had been fully vaccinated as of today. The number of those who received the first shot stood at 81.9%. To minimize the amount of wasted vaccines, in May 2021, we launched a system for people to receive their first shot on the very same day when they book a vaccine left unclaimed from canceled appointments. Also, from September, we allowed people to receive their second shot on the very same day when they booked a leftover vaccine. Up until now, more than 4 million doses have been administered through a vaccination booking system. In the case that any causality between suspected adverse events and the vaccines has been verified and recognized, we are providing compensation. 0.46% of vaccine recipients, or around 364,000 people, reported adverse events until today. For serious adverse events, emergency response teams from local governments and the KDCA's Vaccine Adverse Events Investigation Team assesses any potential causal link. KDCA implemented a medical expense support for vaccination adverse reaction that went into effect in May 2021. Under this policy, though excluded from eligibility for compensation because of the lack of data needed for verification of any causal link, expanded the medical expenses to a maximum of 30 million Korean won is provided. From September, eligibility expanded to mild adverse events of special interests from those with severe symptoms. Also from last June, expanded medical expenses to include nursing fees of 50,000 won per 1 day. This way, by proactively improving relevant policy, we are making efforts to strengthen the government's responsibility for vaccine adverse events. In an effort to mitigate vaccine hesitancy, we have established Vaccine Safety Committee operated by the National Academy of Medicine. Through this committee, we will make efforts to minimize hesitancy by immediately and transparently providing assessment results on vaccine safety and causality issues. As a phased return to normal life is in progress, confirmed cases and transmissions are more likely to increase. For such possibility, we have enhanced our anti-COVID capabilities. Just for one example, we have improved the efficiency of a diagnostic testing system and increased the PCR test capacity. This way, we are preparing for the possibility of an increase in confirmed cases amid a gradual return to normal life. Also preparing for a surge in PCR test volumes by diversifying testing methods. With vaccine efficacy waning over time, we announced and proceeded the implementation plan for booster shot administration and the strategies to raise vaccination rates among the unvaccinated. Booster shots are now being administered to high-risk groups and can be expanded to other groups in phases. To encourage more people to get vaccinated, we have come up with multiple measures, strengthened our capabilities of dealing with adverse events, increased compensation. With a plan for a phased return to normal life, we put quarantine pass, as we call vaccine pass, in place. If fully vaccinated, visitors are allowed to enter multi-use facilities or events when they show either proof of vaccination or a negative COVID-19 test result. The KDCA is also investing all the resources available in the research and development for COVID-19 therapeutics. On 17 September, the monoclonal antibody therapeutic was approved for making by the Korean Ministry of Food and Drug Safety, and on 11 November, EMA, European Medicine Agency, recommends authorization. Final slide. For development of COVID-19 vaccines, we are providing intensive support for clinical trials of 8 Korean vaccine developers, with the goal of bringing at least one vaccine into the market in the first half of next year. Thank you for your attention.
감사합니다.
Thank you very much.
다음으로
Now we are going to have Ms. Park Hyung, Director General of Disease Control and Coordination Task Force Team. She's going to talk about the implementation plan of COVID-19 recovery to a new normal.
네, 안녕하십니까?
Good afternoon, everyone.
일상회복
I'm Park Hyung, Secretary General of COVID-19 Recovery to a New Normal Committee and also Director General of Disease Control Coordination Task Force Team. I would like to give my thanks to all of your participation to today's press briefing. I would like to talk about the implementation plan for Korea's gradual recovery to a new normal, which was announced on October 29th. First of all, let me talk about our progress of response to COVID-19. There was the first confirmed case in January last year. Ever since then, we are now at the fourth wave of infection. Korea has taken 3 key strategies: trace, test, and treatment. And along with this, based on social distancing measures, we have minimized the damage from COVID-19. Vaccine rollout was started from February this year, and as of October 23, 2021, 70% of our population completed their vaccination. High vaccine effects and vaccination rates help to execute the recovery plan to a new normal, which was announced on October 29th. We are now closely looking at the short-term spike of confirmed cases. In order to respond to COVID-19, Korea has set up a government-wide governance driven by the Central Disaster and Safety Countermeasure Headquarters, working with Central Disaster Management Headquarters and Central Disease Control Headquarters. In particular, Central Disaster and Safety Countermeasure Headquarters is led by Prime Minister. Both central and local governments are participating in the 3 weekly meetings, and all those meetings have been held online, so anyone from local and central governments can easily participate in the meeting, and we can easily check the overall decision-making process. So this is the list of overall progress of COVID-19 response measures for your information. Now I would like to talk about why we need to make a transition for a gradual recovery. On September 17th, 70% of population completed the first shot, and on October 23rd, second shot was completed. In case of the vaccinated, their deterioration rates has decreased, and also the death toll has clearly decreased. So we can easily estimate that the overall damage, health damage from COVID-19 could go down. However, there are mounting damage on every sector in our society, and despite the economic support such as COVID-19 Emergency Relief Fund and damage compensation, a lot of damage have been focused and concentrated on independent business and low-income class. And also the fatigue of healthcare professionals has become very serious. With proactive and efficient preventive measures, Korea could minimize the damage from COVID-19. And also, our economic recovery rates rank one of the highest among OECD countries. In addition, our public has actively participated in social distancing measures and vaccination. So based on self-autonomy and responsibility, we could take a gradual recovery plan to a new normal. Next is about the policy direction. Based on high vaccination rates, we are going to reorganize the overall infectious disease prevention program. Instead of universal and facility-based regulations, we set up the principles based on the risk of infection, and we also improve the efficiency of contact tracing and public health measures. Not only the government, but all the stakeholders can come up with their own comments, and also they can participate in the decision-making process. And we also prepare the contingency plan in case of the spike. This is the details. First, let me talk about the reorganization of social distancing measures in the gradual recovery plan. The main principle is that we are going to move from universal regulations to curb down the pandemic to the regulations that focus on protecting the vulnerables and also improving the vaccination rates. By comprehensively assessing the vaccination rates and hospital bed operation rates, we are going to carry out the overall disease control measures on 3 different phases. And the disease control will be relaxed for the vaccinated, and based on self-autonomy and responsibility, disease control and prevention can be executed. And if, in case of the shortage of medical system, we are going to prepare the contingency plan to stabilize the pandemic. The recovery plan was started from November 1st. The first phase will be operated for 4 weeks, and after that, there will be 2 weeks of assessment period. And by assessing the overall conditions, we are going to decide whether to move on to the next phase or not. In the new social distancing measures, it will be nationally integrated with the same criteria, changing from the past regionally different measures. The local government can make their own decision by considering their overall conditions. Along with this, commercial facilities can be operated, and massive events and social gatherings, personal gatherings can be allowed. Vaccine pass and negative PCR result certificate or so-called COVID pass will be explained. In order to support the recovery to the new normal for the vaccinated and in order to prevent any spread of unvaccinated, we are going to introduce the COVID pass for vulnerable facilities and high-risk facilities. By considering the risk of infection and the necessity of such practices and behavior, the exception can be allowed for PCR negative result and those who fully recover from the confirmation and teenagers and children under the age 18 and unvaccinated for inevitable reasons. In the first phase, high-risk facilities and the facilities that are vulnerable to infection will be introduced with this COVID pass. In the second phase, massive-scale event and conference will always require COVID pass. However, negative PCR test result and COVID pass will be required for indoor and also indoor where mask wearing is difficult. From the first phase, some facilities will require COVID pass, and after the assessment for its efficacy, we are going to release in the second phase, starting from the low-risk facilities. And also the key principles will keep mandatory, such as wearing mask inside and QR code and check-in call. And also by promoting and encouraging the COVID response measures, and the local government's role will become much stronger. In the process of transferring to the recovery to a new normal, the overall burden on medical staff and healthcare professionals will become much higher. And if disease control becomes much more difficult, then contingency plan will be launched. ICU operation and hospital beds operation rates can become difficult, and also considering the possible spike of severe cases and death toll, if the overall situation gets worse, then contingency plan can be executed. Now I would like to talk about the healthcare and medical response. Depending on the severity of cases, our treatment will become different. Patients with no symptoms or light symptoms will go under residential treatment care or receive home care treatment. Moderate patients can be treated on the hospitals designated for this infectious disease. And in case of severe patients, they will go to the ward for severe patients in general hospitals. So the government's principle is that for all confirmed patients, government will take the responsibility and provide the right level and the appropriate treatment for free, depending on the level of their severity. What we can commonly confirm from the cases in overseas, after we take a recovery plan, there will be the short-term spike of confirmed cases. So in the short term, we will continue to closely monitor the pandemic and also the increasing confirmed cases. And also we will prepare the medical responsive system considering the maximum figures. And also we will continue to expand the home care treatment and also additionally secure the hospital beds and also ICU beds. In the mid and long term, we are going to incorporate this healthcare responsive system and measures to the local community. Now I would like to elaborate on the measures to expand the home care treatment. At this moment, confirmed patients under age 70 and also the confirmed and the patients with no symptoms and light symptoms are subject to receive home care treatment. Home care treatment doesn't mean that they can be treated only at home. Instead, under the government's responsibility, they can safely and comfortably treat it at home. To that end, we are going to newly establish home treatment management team in the local government and also working together with the hospitals nearby and fire stations. Prompt patient transfer system will be established. This is the detailed procedures of home care treatment. Depending on the severity of their cases, local government will confirm the target patients for home care treatment. And second, by working together with the hospitals, health monitoring and contactless treatment and diagnostic will be executed. And also to that end, the home care treatment kit will be provided, including oxygen saturation measurement. And based on 24-hour contact with local government and hospitals nearby, in case of emergency, the patients can promptly deliver to hospitals. And last, on the 10th day, by considering the clinical progress, medical professionals and hospitals can make a decision, and the home care treatment and isolation will be completed. Next, in order to secure hospital beds, we are going to provide customized and tailored consulting services to hospitals. And also by issuing administrative orders on November 5th, we have secured hospital beds for moderate case and severe cases. In order to improve operational efficiency, we are pursuing the joint usage of hospital beds in both capital and non-capital areas. Now let me talk about overseas entry procedures. So far, our evaluation index has been based on the number of confirmed cases in countries. However, that evaluation will be now focused on the vaccination rates and the number of confirmed cases. And the risk classification will become more simplified from level 4 to level 3. And visa restriction will be eased. In order to prepare the gradual recovery to a new normal, the government has gone through diverse social discussion. The government established COVID-19 Recovery Support Committee. And both private and public sector have worked together on every part in our society. We have hosted 2 times of expert panel discussion and did a public survey and also did the public hearing, thereby listening to the comments from our public. Our recovery plan to a new normal aims to become a better Korea. Based on our citizens' self-autonomy and responsibilities, we want to achieve better lives through gradual and phased recovery and achieve happier lives through inclusive recovery, and all these recovery will be created together. So we are moving toward a better Korea. To that end, our committee is going to focus on economic stability, revitalizing society and culture, and ensuring self-autonomy and safety, and also strong healthcare and disease control. Next is the key schedule. Based on our execution plan announced on October 29th, we launched a gradual recovery plan to a new normal on November 1st. Moving forward, the Korean government will continue to work together with all the stakeholders, and we will continue to explore the better measure and better way to make a better Korea. Thank you for listening.
발표 감사합니다.
Thank you very much for that presentation. And now we'll move to the last presenter, Lee Gang-ho, head of the Global Vaccine Hub Promotion Group at the Ministry of Health and Welfare. We'll talk about the K Global Vaccine Hub strategy and expected outcomes.
안녕하세요.
Good afternoon. I'm Lee Gang-ho, head of the Global Vaccine Hub Promotion Group at the Ministry of Health and Welfare. The Korean government is currently pursuing the K Global Vaccine Hub, and I'll talk about that, its strategy and expected outcomes. First, progress and background. Now, we had in May the summit between the U.S. and Korea, Korea-U.S. summit. After that, Korea decided to build biopharmaceutical manufacturing capacity for a global hub for vaccine production. And so there was a lot of business results on the business side in industry, and the government also made plans for attraction of investments from Cytiva and Sartorius. Those are some investments that we were able to achieve. Now let's look at the background between this plan. Basically, the COVID-19 pandemic has become prolonged, and vaccine inequality and shortage issues are a big threat. So there's a need for quick production and supply. The WHO has also provided plans for vaccine production and supply. But still, there's a lot of shortage for this. So there's a lot of countries, such as Korea, that have the capacity to produce vaccines. And so that's the reason that we're trying to build this vaccine hub for that. And also, like I mentioned, we have the production capabilities and development capabilities. So if the private and public partnership is in place, then Korea can be in a suitable situation to produce and develop vaccines. The goals and strategies. Now, by 2022, first half, we're planning to roll out our first homegrown vaccine. Currently in the market, number 9. We're in the global vaccines market, number 9. But by 2025, we're planning to bring Korea's status to number 5 in the global vaccines market. If we look at our strategies, first, we will do rapid development of homegrown vaccines. Strategy 2 is expanding global cooperation for vaccine production. And strategy 3 is the early establishment of infrastructure necessary to become a global vaccine hub. If you look at the details, I will talk about vaccine development. Currently in Korea, there's 8 companies that are in clinical trials at the moment for vaccine development, and they are developing vaccines on various platforms. First, the subunit platform is done by SK Bioscience, U-Biologist, and HK Innoen. So 3 companies are in clinical phase progress right now, and then the viral vector is done by Cellid, DNA, Genexin, and Gene1 Life Science, RNA, Quaratis, and mRNA iGene. SK Bioscience already, after August 10th, was approved of phase 3 clinical trials, and currently that is ongoing. Next, to become a global vaccine hub, we need a global vaccine partnership. Last May, we had the ROC-US Summit, and from that point on, we built a Korea-US partnership. And through that, a Korea-US expert group was established and operated. Also, we held business roundtables for R&D discussions and cooperations, and we are currently strengthening R&D cooperation on that respect, not only with the United States, but Korea is also scaling up global cooperation with other countries and partners as well, like the UK, Canada, Germany, and Australia. And we are planning to continue to diversify our partners in vaccine cooperation. Plus, we are also working closely with the WHO. The World Health Organization also has a global vaccine hub strategy. There's a technology transfer hub that it's working on, as well as building talent and workers for the field. In Korea, we are focusing more on a biopharma training hub with the WHO, and we're building our capacities to work with the WHO in that respect. Also, Korea is cooperating with the Asia Development Bank, ADB. In the region, for developing countries, discussions are ongoing to create a joint production hub with the ADB. And so ADB and Korean company, ADB providing the funding, Korean companies the technology to develop vaccines for countries in the region. Also, in October, Korea signed an LOI for training workforce from developing countries. So in Korea, we will do specialized training for developing country medical workers and train them in vaccine technology and send them back. This kind of global vaccination hub plan requires many capabilities. So domestic manufacturing capacity is one. So that's what we're building on, manufacturing infrastructure. Also many policies to get the supply of raw materials and consumable supplies, and also investment attraction is also necessary. In the future, to develop vaccines for the future endemics as well, and also for high value added vaccines and vaccines that private businesses are unwilling to develop. These strategic vaccines are what Korea is going to develop. So from development to manufacturing to commercialization, the government is supporting the initiatives of the vaccine industry. Next, supporting for enhancing Korea's global presence. First, we'll work on building a global sales network, and this is going to be done through the CEPI marketplace. So Korea is joining the global vaccine network through the CEPI marketplace. 11 Korean companies are already joined, and 2 are already in the network. Also, to provide support for exports, we're doing that. Also, global R&D efforts are underway as well. And through these efforts, the government, private industry, and civil society together, through joint research and efforts, we believe we can be able to contribute to ending this pandemic, and within 5 years, building our status to world's number 5 vaccine producer. And so, right now, in the WHO, there's 4 countries that are doing commercialization of vaccines, and Korea will be registered in this group. And through that, we will try to increase our share of vaccine development and also contribute to disease control and immunization vaccination. So this was my report on how Korea is pursuing to become a global vaccine hub. Thank you very much.
단장님 발표 감사드립니다.
Thank you for your presentation.
그럼 이제 본격적인
So from now on, we are going to have a Q&A session.
질문은 현장 질문과 온라인 질문.
We are going to receive questions from the site and also from online. Since there are foreign correspondents from various countries around the world, I will give you a lot of opportunity to give questions. Those who have a question, please raise your hand and also introduce yourself and then ask a question. And those who are going to give the answer, please introduce yourself before giving the answer. So we are going to start.
장경입니다. 오늘 그 신규
Park
환자
Chang-kyung from South China Morning Post. Today, can you please explain why there is a dramatic increase of breakthrough cases and also severe confirmed cases? And what about the proportion of breakthrough cases? Is it much higher than other countries or lower than other countries?
질병관리청에서 말씀드립니다.
So I will give you the answer from KCDC. It is true that the newly confirmed cases has spiked today. In particular, when you look into the breakthrough cases, those who are over the age 60 is more than 50%. Rising confirmed cases is mainly because of our recovery plan to a new normal, and the actual increase of confirmed cases has been somewhat expected. However, this is the winter season. We are going into the winter season, and also we are very vulnerable to any respiratory disease. And actually, Korea has not started this recovery plan from the lowest point. So actually, this type of a surge of confirmed cases was somewhat inevitable. However, high-risk group that we wanted to protect from this COVID-19, for example, those who are over 60s or the severe cases and the death toll are also under great consideration. And at 2 p.m., we are going to speed up the booster shot. And we are also making all-out efforts. However, what I would like to stress here is that this is not the challenge only for Korea. Actually, this is the challenge commonly faced by all countries, especially European countries and Northern European countries. So more close inspection and analysis are highly required. So personally, I have a lot of interest in Japan. And the actual vaccination in Japan is almost equal to that of Korea. And also the ratio to reach that level is also similar to that of Korea. And ever since then, there has not been that much concerns in case of death rate and deterioration rate. And in that regard, we are taking a very close look at the trend and progress in Japan's COVID cases. However, in case of Japan, most of them are vaccinated by mRNA vaccine. But in case of the vaccine, which is not mRNA, are not mostly used in Japan. I think that might be one of the key differences in the progress. And that will be fully considered for booster shot or also the further vaccination process moving forward.
네, 원장님 답변 감사합니다.
Thank you very much for that answer. The next question, please.
일본 신문사 산케이 신문의 도쿄시 기자입니다.
Case a newspaper and from Japan. I want to ask two questions. Now, infection rates, it's gone up. We mentioned that, but severe cases have also gone up. And the gradual return to normalcy, did you expect these numbers to go up as we enter into normalcy? If you did not expect this, then why not? Why is this sudden rise of severe cases going up as well as transmission rates? And MONA, you talked about that, mRNA, but the aged population, they took a lot of AstraZeneca vaccine, as I understand, and the vaccine types, a lot of people have taken AstraZeneca. Does this breakthrough infections and so forth, does it have something to do with that? Well, first of all, the increase of severe cases, let me answer that question first. First of all, overall, there were other countries that vaccinated their population before us, and there was a lot of 60 aged or older high-risk group people who took the vaccine or had baseline conditions. So it's waning. Basically, if you take the vaccine, there's a waning effect. The efficacy drops. And even in the beginning, there's a weakened immunization of certain vaccines. So maybe because of that in Korea as well, for people aged 60 or older, we're trying to get early these booster shots. And that's what we're doing. That's what we announced today. Not only the population for the booster shot, but bringing that forward so that in the community we can build herd immunity quickly. We're trying our utmost efforts. And there might be something that you might have misunderstood in my earlier response, but it was just my personal observation about Japan. I'm not saying that some certain vaccine has less efficacy. I don't want to state that officially. What I'm saying is that we look at the numbers, and according to statistics, that's something that I've observed. So according to studies, a certain platform of vaccine, the efficacy was relatively higher. That was noticed. Of course, all vaccines, the WHO has approved it, and they all have a certain level of efficacy. But what I'm saying is that certain platforms, there's a hypothesis that we could establish. That's what I'm saying. So earlier in my response, I don't want there to be any misunderstanding. I don't want to single out any certain platform. I don't want any misunderstanding. And this is not the KDCA's official position. As the head of the NIH, I'm just stating my observation and the trends that I see currently in vaccination. And I was mentioning the case of Japan because I feel that the Japanese case is very peculiar, so we want to observe that closely. That's what I was mentioning. Thank you very much. And let me give you an additional answer on that. Like you answered, right now, the transmissions are going up, and because we relaxed our COVID-19 regulations and restrictions, that's something that we have expected. And so naturally, when we relax regulations, this is going up. But in the case of severe cases, for aged population, especially high-risk aged population, the population which we gave shots to first in the nursing homes or medical facilities, it was like February to May. They were the priority vaccine receivers. And so we believe that the waning effect came more quickly than we expected or anticipated. So in these nursing homes or medical facilities, there's a lot of breakthrough transmissions happening, but compared to the overall infections, it is that the severe cases are going up there. So because of that, that's why we are implementing booster shots earlier, 4 months earlier than we have planned. That's because we want to swiftly go into these nursing facilities or nursing homes to the high risk groups in the age population and immunize them with the booster shots so that we can build a better immunization. That's the plan, you see.
Yeah, Nicola Roca for Radio France International. I wanted to ask, why do Koreans that have been vaccinated abroad eligible to the vaccine pass, and why isn't it the case for foreigners that are in the same situation?
제가 설명드리겠습니다.
Let me give you the explanation on that question. At this moment, those who get vaccinated from overseas, depending on the types of vaccines, they will go under the vaccine incentives. Those who get vaccinated from overseas, those who receive the quarantine waiver from the diplomatic offices for the purpose of business, they can apply for quarantine waiver to our embassy. Then they can receive vaccine incentives. However, if not, if they just enter Korea without gaining any quarantine waiver, even if they are submitting the vaccine pass, we cannot give them the incentives because it is hard to carry out the confirmation process. So in order to execute the confirmation, that is the reason why we are asking for quarantine waiver issued by our diplomatic office in overseas. And regarding this matter, we are also having some talks and discussions with other countries. Some countries have some standardized format for verification, while other countries are also acknowledging some kind of verification form issued by the clinics or hospitals or local government. So we are currently reviewing this and discussing this matter with countries overseas. And in the confirmation process, after we establish some kind of system, then without any pre-application, only with the verification scheme for vaccination, we are considering the way to give the vaccine pass. On top of that, as you just mentioned, recently, the UK ambassador to Korea also mentioned that this is a clear discrimination against the foreign residents and foreigners in Korea. As Mr. Son just mentioned and you just asked, Korean nationals, even though they get vaccinated from overseas, can receive some quarantine pass or COVID pass or vaccine pass. However, those foreigners who got vaccinated have some difficulties to receive such COVID pass. However, in the international airport, we are not asking for the verification format of vaccination. However, we just started such a COVID pass for the Korean nationals first, and as you just mentioned, the vaccination format and verification form are different from country to country. Some countries are issuing the paper format, or other countries are issued by the local government or clinic. So once we set up some kind of definition, then that can be also followed by other countries as well. And it is true that the overall vaccination rate has increased, and also the scope of applying the quarantine pass or vaccine pass will be expanded. So we will also actively consider the way to expand the vaccination pass for foreigners as well. Thank you for your
질의
answer.
있으신 현장
Any further
기자님께서
question from the site?
네, 가운데 기자님.
Yes, so over there in the middle.
Hello, Andres Sanchez from the Spanish news agency. I would like to ask, regards to the Ministry of Health. We just entered living with COVID phase basically some weeks ago, but seeing how the numbers are evolving here and what is happening, for example, in Europe, can we expect not only, let's say, lagging of phase 2 and 3, but also maybe the implementing soon of restrictions again when it comes to, for example, curfew of high-risk facilities, the number of people gathering, etc. Thank you.
네, 답변 부탁드립니다.
예, 지금 말씀하신 대로
Yes, just like you mentioned now, we talked about European nations. They actually vaccinated their population earlier. And if you look at the vaccination rates now, Korea's vaccination rate is very high, more than Europe, I think. In Spain is very high, the vaccination rate. Portugal is like 80% or more, I think, the vaccination rate. But the UK is like 60% in the late 60s. So there's actually Northern Europe we observed a lot, Denmark, Norway, and these countries we observed, and their vaccination rates currently are lower than Korea's vaccination rate. So, but even before that, they went into gradual recovery to normalcy. But in the beginning, unvaccinated groups, basically there was a lot of transmissions in the unvaccinated group. But now, because of the waning immunity, after taking the shot, there's some waning effect. And so there's some breakthrough transmissions there. But in Europe, and we saw the transmissions going up, and in the United States as well. They were the leading vaccinated nation, but they're having difficulties going back to or recovering normalcy. So Korea has been observing these situations, and there's the vice minister here and other representatives of the Ministry of Health and Welfare. But we talked about these danger indicators, risk indicators for going back to normalcy. Well, basically, we're looking at all of these indicators, and we're monitoring this weekly, and we observe these numbers. And based on that, we're going to talk about recovery to normalcy. Earlier, it was 4 weeks. But we look at it 2 weeks earlier. We talked about that even before November 1st when we went into this stage. And now, nationwide, when you look at the situation nationwide, we don't think that it's too severe. In the Seoul metropolitan area, we see some rising cases and numbers, but in the future, we do expect that in the older population and the high-risk groups, there could be more transmissions. But that's what we look at right now. That's the forecast. So we continue to monitor not only Korea, but abroad as well, the situation. And as I answered earlier, a very interesting case for us is Japan, because Japan has a very similar vaccination rate as Korea. And it's just different population brackets that are different. But it's not only a Korea situation, you see. The global situation is similar. So in that, we will move prudently. But I do want to make appreciations, too, because the KDCA, we also talk to foreign governments, but also to the reporters here, journalists from many countries. You are the risk communication channels of the world, and through all of your efforts, we also get information. So thank you as well. So let me just add a little bit to that answer. So currently, right now, we're going back to recovery process, and we don't feel that we need to discontinue that. Going back to strict regulations, I don't think it's a situation like that yet. So like we mentioned, we look at the transmission rates going up, but that was expected. When we relax regulations, transmission rates will go up. But when we do weekend tests, the test numbers are down, and then you see in Wednesday the numbers go up, and then Monday and Tuesday you see that the infection rates are low. So when you look at it on average throughout the week, the confirmed cases, about 15% increase of confirmed cases we see right now. That's what we observe, and that's within the range of what we expected. So we see a rise in cases, but it was within the boundaries that we expected. And so somebody mentioned about severe cases going up, and that is faster than the overall confirmed cases. And the point with that severe cases are going up is because these are nursing facilities or medical facilities that are vulnerable sites. So we have to monitor more closely the infections that are taking place in these nursing facilities or high-risk sites. That's the current position of the government.
감사드립니다. 네,
Thank you for your
질의 한번 더
answer. We will receive one more question and then we will move on to online question.
가운데 계신
Those who are in the middle.
부탁드립니다.
Hello, my name is Morten Sondergaard. I'm the journalist from the Danish newspaper Jyllands-Posten. And as was mentioned briefly by Mr. Kwon, in Denmark we stopped considering coronavirus as a critical disease and completely returned to normal. But recently we have again begun introducing restrictions. So I'm just curious, what here in Korea, what is the quote-unquote fail-safe? At what point does the gradual return to normal life stop?
제가 답변을 좀 하고 창아님이나 국장님
So let me give the answer to this question first. So while executing this recovery plan, the thing that we explain to the public is that instead of focusing on the total number of confirmed cases, we will focus more on economic and social damage. We want to think about the overall social damage from this COVID-19. Instead of the actual complete number of confirmed cases, we are going to focus more on severe cases and the death toll. So the most important point here is that we could handle and cover the severe cases and the serious cases of this pandemic. At this moment, while existing and maintaining the general medical and healthcare system, we are currently separately operating the healthcare system handling COVID-19. And even though we focus on handling the COVID-19, it doesn't mean that it has some negative impact or hamper the overall medical and healthcare capacity. And 60% of healthcare capacity is currently under operation. At this moment, across the nation, we continue to leave 40% left. However, there are some differences in the region. In case of Greater Seoul area, we have about 20 to 30% capacity left. And also in case of non-Seoul area, we have 60% capacity. So I think the most important point here is that whether the current situation surpass the possible potential capacity of handling this COVID case or not. If not, if the situation surpass that level, then we will go back to the restriction. We can even launch the contingency measure. And this is the Vice Minister from Health and Welfare. Actually, I often receive the question about when is the point to go back to the restrictive measures. Today, the Korean government also announced that we have to take some time and look at the situation. And there are a couple of key indicators that can be the criteria to make a decision. There are 18 different index to make the right decision to take restrictive measures or not. And out of them, the most important critical index are 5, like ICU operation rates, and also the overall capacity of medical staff against the actual confirmed cases, and the number of severe cases, and the ratio of confirmed cases over 60, and also the booster shot ratio over 60s. And based on these 5 key indexes, we will also consider the remaining key figures as well. Even though one index goes up, it doesn't have direct impact on our decision. We will comprehensively consider all these 18 different indicators and then make a decision. And our there is a responsive measure committee subdivision in our recovery committee, and also there are so many different experts working in this recovery committee. So we will make a decision all together based on keen insight and analysis, and also we continue to work together with the Central Disaster and Safety Countermeasure Headquarters as well. So it doesn't mean that there is a certain point or certain measure or certain criteria that we make a decision right away. We have a broad consultation and comprehensive assessment together. Thank you for your answer. We will receive a couple of additional questions from the site.
So to France 24, Lee So-jung will ask the next question. So I'm Lee So-jung from France 24, and I want to talk about the vaccine pass, the quarantine pass that is. I have some questions. In case of overseas countries, if you don't use it, you get a penalty imposed. Does Korea also have that kind of plan? And if it's not able to download, or if it's difficult to use, for instance, foreigners, it might be difficult to use or download, how are you going to promote this or advertise this so that people can use it actively? And then the last question is, I know that you look at some criteria to select facilities and populations, but what exactly is their criteria? Those are three questions. Yes, the Korean K-Pass, the vaccine pass, compared to overseas countries, it's a little bit narrow, the way we operate our vaccine pass, because we have high vaccination rates, and the contamination situation, the spread is being contained quite well. So instead of having a broad vaccine pass, we started very narrowly in restricted ways. So for instance, for facilities that can be used, well, there was a lot of areas where there were cluster breakouts, and we're trying to limit it to those facilities. We're using this vaccine pass to permit entry into these places. For instance, public bathhouses. You don't have that overseas, but saunas or public bathhouses or entertainment facilities or indoor sports facilities or karaoke rooms. These kind of facilities is where the vaccine pass will be used. And for instance, horse racing courses or like that, where a lot of people aggregate. These places, we will ask for confirmation of vaccination or negative test results. That's what we're planning. And so among all multi-purpose facilities, it's about 15%. So the other 85% of facilities, basically the vaccine pass system will not be applied. And for all of these crowd gatherings, that could be high risk. So for places where you have more than 100 people or above in some kind of crowd or event, then we will apply the vaccine pass. And the high-risk groups, we talk about nursing homes or medical facilities for the elderly or for the people with disabilities or people with dementia. For these high-risk groups or vulnerable groups, when you visit these kind of facilities, then we will require a vaccine pass. That's the kind of operation that we're seeing. So these are the three large groups where we will operate the vaccine pass system. And if you do not, if you violate vaccine pass, let's say, then not only the facility owner or operator, but the user of those facilities will be penalized. There will be penalties imposed, a fine of about 3 million won for the facility owner, and for the violators themselves, about 100,000 won penalty will be imposed if the vaccine pass is violated. And the procedure, of course, you have to download a smartphone application. That's the most convenient way, and the young people tend to use that way more and prefer that. But you can also use document certification. We also recognize that as well if you have a printed document. And also Korean people, they have a national identification card, and we will put stickers if you're fully vaccinated on your ID card. So for Korean nationals, you can also use that kind of national identification card as a vaccine pass. So we're using that kind of modalities. And overseas, we know that there's vaccine passes overseas, and we, in the future, when we do our administrative work, we're going to review that so that overseas issued vaccination passes will also be accepted. Thank you.
안녕하세요. 제가 그 러시아의
Hello everyone. I'm Rosia Segudia, Andrei Alford from Russia. This is related to vaccine approval. This can be only the interest from Russia, but I don't think the case. Actually, this vaccine has been approved from 70 countries around the world, and around 100 million people are vaccinated around the world. And actually, such vaccination has been taken place in the Philippines, Israel, and many other countries. And they can enter and they can travel around without any quarantine period. And actually, there has been more than 1 year of review. And I think it might be much faster to ask for the consideration and application to the Ministry of Food and Drug. And I think that the Korean government is well aware of this drug. And do you think that the approval from WTO can be made soon? Or if that becomes delayed, then do you think that you can make an immediate approval? About the domestic approval about the Sputnik vaccine that you mentioned, actually, the accurate answer can be given by the Ministry of Food and Drug. However, unfortunately, we don't have any attendance from that ministry, so we cannot give you the exact answer right away. However, we continue to do the preview process on that vaccine. And actually, the official approval has not been made against the Sputnik so far. Actually, for all vaccines, we are doing the preview. But regarding this vaccine, like Sputnik, it is still under preview. So if the official application is made, then the Ministry of Food and Drug will also consider the review. And for more exact details, it might be better to check with the Ministry of Food and Drug. And about the recognition of completing the vaccination, Korea seems to follow after the guidelines of WTO. And it seems that they are only allowing the vaccines recognized by and approved by WTO. And about the vaccine you just mentioned, as far as I understand, it is currently under consideration by WTO. And if the approval is made by WTO, then it can be also approved by the Korean government as well. And for your information, as Vice Minister Liu just mentioned, research, approval, and all the process are disclosed on its homepage. So when you visit the homepage of the Ministry of Food and Drug Safety, you can see the overall process of Sputnik. And the actual application has been started from September, and it is still under preview at this moment. As Mr. Son and Vice Minister Liu just mentioned, actually, this is the key core responsibility made by the Ministry of Food and Drug Safety. And also there are 2 other vaccines that is under consideration and deliberation. And actually, we cannot say about the separate name of vaccine at this moment, but we are definitely following very fair and transparent procedures. And the result is always disclosed to the public. Thank you for the answer.
Okay, last question from the floor here, and then we'll go to online questions. So let's give the microphone to the next reporter, please. 네, 스페인, 안드레스 산체스 브라운, EFE 통신 기자 다시 질문 드리겠습니다.
When we were talking about 15% of these facilities where the vaccine pass will be asked for, are we talking, for example, are we including restaurants, bars, nightclubs, sports centers, movie theaters, this kind of place? Is it going to be included in these high-risk facilities? Thank you.
Yes, that is correct. Maybe I was too vague earlier, but Korea, right now, or movie theaters and restaurants, it's not applied. I know that overseas, the vaccine pass applies to restaurants a lot, but in Korea, we do not require vaccine pass for restaurants, but it's the entertainment facilities. Now, basically, when we talk about that, clubs, like nightclubs or bars and pubs, that's what it is, basically. So, or other singing rooms, karaoke rooms, or there's some entertainment facilities unique to Korea, but usually those facilities will require vaccine passes. And then indoor sporting facilities, we believe that's a high-risk group area, so that as well, like health fitness centers or swimming pools, that as well will apply vaccine pass. And then, like I said, singing rooms or karaoke bars, these areas as well, and yes, sauna, that's public bathhouses, saunas. Those are where vaccine passes will be required. Restaurants, we're excluding that because there are some people that need to eat, right? And so if we put that in place, because 90% of 18 years or older people in Korea have been fully vaccinated. Only 10% are unvaccinated. And so for those 10% adults that are unvaccinated, if they have to go and take a negative test result all the time to go to a restaurant, that's realistically quite hard to do. You have to eat, and that's a necessity. So if you cannot allow people to eat, that could become a big social problem. That's why we do not apply vaccine pass to restaurants. So I think there's an additional follow-up question to that.
I wanted to ask, actually, the fact that you're going to exclude restaurants. Precisely in Korea, my understanding is that nightclubs, bars, and pubs facilities actually operate, many of them, under restaurant licenses, actually. So I would like to know if there is are you going to reevaluate that sort of thing, for example?
No. So for the classification of the business, we have categorized that. So like you said, the nightclubs, basically we're deciding to apply vaccination pass on that, and we have this category. So when you get approved, you might get approved your business license as a restaurant on your business registration, but we look into the practical use of the facility. If you go and you're dancing or using as an entertainment facility, regardless of how you're registered, we look at how the facility is actually used and then apply vaccination pass. And I said that we don't apply vaccination pass to restaurants, but we do limit the gathering number for unvaccinated people. So unvaccinated people can only gather 4 people. So if you're unvaccinated, you cannot exceed 4 people at a table. So that's something that we do regulate. So we're trying to at least maintain that kind of restriction. That's one thing that I would like to add. So thank you very much for that.
So due to time constraint, we are going to give the answer to the online question. The first question was from Mr. William Gallo, the US VOA. The question was in English.
Advice for fully vaccinated foreigners who are unable to register their overseas vaccines. Should they proceed to get additional vaccinations in South Korea so as to resume daily life activities as Korean nationals can do? 외국인의 백신 방역 패스 적용 관련 문의사항으로 해석됩니다. 답변 부탁드립니다.
예, 아까 답변 저하고 송영래 국장님이 말씀을
I think I have given the similar answers before. So temporarily from October 7th, those who get vaccinated from overseas, they can apply for quarantine waiver from the Korean embassy to the foreign countries concerned. And if that is the case, they can be their vaccination is acknowledged and recognized as well. However, that matter is currently under consideration at this moment, and also depending on the progress of our recovery plan and also our vaccination rates, we are currently fully consider about the way to allow the vaccinated foreigners to receive the same benefits as Koreans. Of course, we fully understand about your concerns and difficulties, but about the answer to the question that I received first, I think I also give the similar answer. Actually, I think the question is a little bit consuming. The foreigners, in case of foreigners who are receiving the incentives, does it mean that they have to get additional vaccination? If they get, actually, we do not decide giving the incentives just because they receive the additional vaccination. Actually, we are providing the vaccine incentives depending on their vaccine completion and quarantine waiver issued by the Korean embassy to foreign countries. And foreigners who are receiving the incentives at this moment do not need to receive additional vaccination. Their previous vaccination completion is more important criteria. Thank you for your
다음은
answer.
미국 NBC 김성희 기자님의
Next,
질문.
Kim Sung-hee from NBC, United States Media, will give a question to Mr. Kwon. For the nursing facilities, they will take additional booster shots, Pfizer or Moderna. Is that correct? That's the first question. And then you said the fatality rate is 0.78% currently due to COVID. Is that on average? And compared to the flu, how serious is the fatality rates or severe cases due to COVID-19 and the death rates going up? Is that because the vaccination is waning and the effects are dropping, or is it because of complications? So first question, I'll take that one first. Already, a few weeks ago, I think it was November, December plans for vaccination we announced, but basically mRNA vaccine is the principle for our booster shots. And if possible, we recommend the same vaccine as the original vaccine that you were vaccinated with. So it's Pfizer and Moderna, but 60 years or older would not have taken Janssen. If it's Janssen, it's 2 months apart, the vaccination. But if you do want the Janssen vaccine, you can receive that as well. And Moderna, for the booster shot, it's only half the dose. That's what we're going to do with the Moderna vaccine. And number two is comparing with influenza. Each country is different. We have 0.78%. That's the case fatality rate at the moment. And when COVID-19 was first found in Korea, that's the number from the very initiation of COVID in Korea. But actual rates, sometimes it went up to 2% at one time. But right now, if you just look at fertility rates at the moment, it's very low, 0.3, 0.2% right now, the fertility rate. But if we compare with influenza, compared to influenza, COVID-19, the fatality rate is 10 times higher. And the in-hospital period is double than flu. And there are more severe cases than the flu. So all data from all countries are similar. They show this fact. So if we compare with influenza, it's not something that we can recover to normalcy easily like the flu. And we cannot consider it and manage it like the flu. It's different for sure. And the last question, I think, about deaths, it's not complications that much, but accessibility to medical services would be the biggest reason. And Recurona, for instance, Korean therapeutics, also other treatment facilities being offered. I think if medical services are provided, complications or other things can be resolved. But it's more about being unvaccinated, or even if you're vaccinated, to vulnerable groups, to high-risk groups, there is a decrease of immunization naturally. And so these older groups or high-risk groups, you can see the waning effect or immunization dropping. So that's the reason that we see that. So that's why we're promoting booster shots and so forth and other measures. And about if you've received a a flu shot in September, the next year you can get the flu again, right? So you have to get vaccinated again annually each year. So it's about vaccine hesitancy or mistrust of vaccine. We don't want it to lead to that. So regarding the COVID-19 vaccine, we made announcements today, but we really urge people to take the booster shots and within a short period of time, we want to reduce the gap of getting your booster shot. That's what we're trying to do. Thank you.
온라인 질의 하나 추가로 답변 부탁드리고.
So due to time constraint, we will have one more online question. This is the question to Director Kwon. The last one is about what is the efficacy of treatment on death rate. Related to the efficacy of vaccine and treatment, the president of Samsung Seoul Hospitals, Professor Park, and all the other experts are under the study of its efficacy. And also, there is already a paper released on the English journal related to this infection and related to this efficacy. Out of the treatment drugs, we are currently doing the study of Reorganization, which is under development by Korea. When remdesivir was studied, that was before Delta variant took place. However, related to Reorganization, we are currently studying that treatment drug as well. And actually, that treatment was released on the paper via peer review, and we confirmed that remdesivir was effective and efficient in treating the disease. However, it was approved and even authorized by the European authority. So I think that the domestic research has been highly recognized by overseas as well. Thank you for your answer. So this is the end of Q&A session. And then we are going to have the closing remarks by Vice Minister. So I think that you have given us a lot of questions during a short period of time, and I believe that we have done our best to give the answer as far as possible. This might be the case for all the other countries, but Korea, already 78% of population is vaccinated, and more than 90% of population over age 18 is vaccinated at this moment. And thanks to this high vaccination rates, we decided to take a very challenging road of a recovery plan to a new normal. However, many countries already taken this road, and we are following their path. But it is true that this will lead to a spike of confirmed cases and also rising severe cases. Around fall and winter last year, there was a high confirmed cases and severe infection in long-term care facilities and also high-risk facilities. Under the similar circumstances, based on high vaccination rates, we focus more on protecting the vulnerables, and we will do our best in this direction. As I just mentioned on the opening remarks, Koreans have very mature citizenship, and based on openness, creativity, and democracy, we have taken diverse disease control measures. And I think that is mainly serve as a great force to take this recovery plan. And our active public support and high citizenship is the main driving force to the recovery to a normalcy. And I would like to ask all the foreign correspondents how we are taking this recovery plan and how we could overcome from this pandemic. Thank you very much.
마무리 말씀 감사드립니다.
Thank you very much for those closing remarks. And with that, we're going to conclude the policy forum on COVID-19 with the Ministry of Health and Welfare and the KDCA. We have provided souvenirs for you on your table, so please take that with you when you leave.
근본에 보건복지부-질병관리청 해외문화홍보원의 정책토론회.
So this officially concludes the policy forum. Thank you very much for your participation today.